Hi, I'm Greg Seward. I'm the Director of the Tobacco Consultation Services as well as Director of the Tobacco Free Initiative. I want to talk with you today about electronic cigarettes. Recently, the Center for Disease Control and Prevention identified electronic cigarettes, sometimes called e-cigarettes, as the cause of fires in the United States and in Britain and a possible threat to safety. In February of 2015, the Joint Commission put a statement on their webpage. They were very concerned about the possible safety issues caused by these devices. In fact, the Joint Commission has stated that organizations, including hospitals, should review and adjust their smoking policies to avoid e-cigarette hazards. They're very concerned about the potential fire hazard in hospitals. In a dangerous episode in a Syracuse, New York hospital, a patient was using an electronic cigarette that exploded and caught fire. The patient was connected to oxygen, which caused the fire to flare and burn her face. To ensure the safety of everyone in that hospital and prevent further explosions and fires, the oxygen system on the floor was turned off. This meant that patients who were hooked up to oxygen to help them breathe had to be switched to oxygen canisters because of that event. Fortunately, this was done successfully, and the patient who received burns on her face did survive. As you can see, the safety issue extends beyond just the person using the electronic cigarette. In fact, the CDC has reported a large increase in calls to poison control centers about electronic cigarettes across the nation and here in Massachusetts. In some cases, children under the age of 6 have become ill after swallowing or touching the liquid nicotine in the electronic cigarette refillable bottles. And we certainly don't want that to happen here at UMass Memorial. While some may argue about personal rights and the effect of using electronic cigarettes compared to regular cigarettes, first and foremost, this is a safety issue that we take seriously here at UMass Memorial. Electronic cigarettes are not regulated by the FDA, and they're potentially dangerous. It's important to note that electronic cigarettes are and have been part of UMass Memorial's healthcare policy for a tobacco-free environment, and they've been banned here at UMass since 2011. This goes right along with our mission to promote and provide a healthy and safe environment for patients, visitors, staff, and volunteers. But what about people who are trying to quit tobacco smoking and have heard that electronic cigarettes may help them transition away from traditional cigarettes? UMass Memorial is always trying to help patients, staff, visitors, and volunteers become healthier. In fact, our smoking cessation programs have been successful in helping patients and staff to overcome their addiction to nicotine. These programs have been tested. The 7 FDA-approved medicines that are on formulary here have been used frequently every day. These medications are often covered by health insurers. UMass Memorial does not allow the use of electronic cigarettes on our grounds by anyone. Please cooperate and do your part. Thanks very much and have a great day.